have you ever heard about using vitamin D for psoriasis? First off, what is psoriasis?
Psoriasis is an autoimmune condition wherein the person's own immune system is attacking skin tissues. And as such, like all autoimmune conditions, they're elusive. Medicine doesn't have a heck of a lot to offer for them, except immunosuppressant drugs, which ultimately is the direction that most people have to go. Yeah. So looking for things that can help in a less invasive way, more natural way, is in this instance kind of important.
Yeah, and so vitamin D is beneficial to it how?
Well, vitamin D has long been known as one of the skin nutrients.
Okay.
And
that's the thing you smell when you lay in the sun.
Yeah, and you lay out in the sun, and you if you smell your arm, it has that sort of sweet smell. Mm-hmm. Yeah, that's vitamin D being produced by skin cells. Mm. And so a lot of people don't go out in the sun anymore.
Yeah.
Because they've been taught to be afraid of it, because skin cancer and all these other things that people choose to worry about. And so supplementing with vitamin D can oftentimes be helpful, especially in conjunction with vitamin C, vitamin A, and magnesium.
So there are cofactors that help it.
Very definitely.
For absorption. And what about, how do you think vitamin D holds up to, let's say, the topical ointments that are prescribed to people with psoriasis?
Well, it's a different approach, certainly. And it depends on...
Can you do them both at the same time?
Absolutely. And it really depends on the severity of the problem and the extent to which the immune system is over-responding. But, vitamin D may or may not be able to solve your problem. But if it can help, then obviously a combination of things is an ideal approach.
And so you just named the other nutrients that go along with vitamin D. So it's vitamin C,
vitamin A, and magnesium.
And then you would always recommend taking all of that with a full spectrum supplement like high vitality liquid from Phoenix Nutritionals or high vitality capsules, because you don't want to just fragment nutrition.
Exactly. If you take high doses of magnesium, for example, it's going to deplete calcium.
Yeah.
So everything has a counter in nature and in the human body. And the biochemistry of the human body has an amazing ability to juggle and regulate and learn to do without this and not enough that. But there's a point where it can't do that effectively. Yeah. So taking a full spectrum supplement solves that whole problem automatically.
Nice. And so what is the ideal dose of vitamin D if someone's looking into this as a alternative and they talk to their doctor about it?
Yeah, I would say to begin with somewhere around 4,000 or 5,000 IUs.
Okay. Is that like throughout the day or all at once?
Yeah, well, because vitamin D is water soluble.
Oh, okay.
I mean, fat soluble.
Soluble.
You can take it all at once. It doesn't matter.
Okay.
Because it's not going to pass out of the system with any regularity.
Yeah, because it's fat soluble.
Correct.
And not water soluble.
Yeah.
Well, very cool. I hope you guys got some good information from that. That'll help you if you're having thoughts about using a supplement for psoriasis.